Welcome to Swapan Lifeline. I am Dr. Swapan Kumar বিশ্বাস. This is a health channel and related to health and hygiene to keep proper health. Today our discussion topics is measles. Measles, this is mainly children disease and sometimes it occurs in adults also. It is highly contagious and serious airborne disease. Infects the respiratory tract mainly and caused by a virus that can lead to severe complications and even death. Global situation: in 82.6 million death occurred, in 211 death was 1.8 million. In India in 211 there are 33,634 deaths due to measles only. Measles virus, it is a single-stranded RNA virus with only one serotype, paramyxoviridae family, and humans are the only natural host of the measles virus. Therefore, if we can eradicate measles virus from human body by means of vaccination, then measles will be eradicated forever like smallpox. Incubation period, that is the period between entry of the virus inside the body and the appearance of the symptoms. First 4 to 14 days the virus multiply in the body, and in this period there is no symptoms and signs appear, and this is called incubation period. Virus enter into the cell of our human body and then use the DNA of cell and reply itself, forming multiple progeny of this virus. Measles are 3 stages. First is non-specific symptom for first 2 to 3 days. There is mild to moderate fever. There is sneezing, running nose, cough and sore throat, and rash appear thereafter in acute illness. The face breakout first, that is spread down to the arms, chest, back, and then to the thigh and lower leg and feet. Usually appear on 4th day of fever. And there is another characteristic sign appear, that is called Koplik spot. It is a white spot with reddish side inside the cheek and inner lining of cheek. It is very characteristic for measles. This is the Koplik spot. In acute illness there may be conjunctivitis also, conjunctivitis of both eye. Recovery of measles. Rash may last about 7 days and gradually fades from face, then to thigh and then to leg. This sequence it appears and at that sequence it disappears. This rash it conglomerates and become brownish, and after disappear there is no scar and no residue remains in the skin of affected person. Period of communicability is 4 days before the appearance of rash and 4 days thereafter. Complications are many and some are dreaded complications. Most common is diarrhea and vomiting. Other complications: bronchitis, laryngitis and cough. This chest X-ray appear pneumonic. This is white patches inside the chest, and there is respiratory distress, and there may be also ear infection. Involvement of central nervous system may lead to meningitis or encephalitis. Encephalitis appears in 1 in 1000 cases. There is another complication which appears 7 to 10 years after infection of measles, and it is called SSPE, subacute sclerosing panencephalitis. It is characterized by the behavioral and intellectual deterioration and seizures. It is a severe complications. Complications in pregnant women may be premature birth, low birth weight, and even fetal death. High risk group: there are several high risk groups who are prone to measles infection. It is unvaccinated infants aged less than 5 years and adults more than 20 years, pregnant women, and people with immune compromised status in leukemia or HIV infection, and people who have vitamin A deficiency. Vitamin A helps to protect from measles. Transmission is direct from hand to hand or person to person, or droplet through air, and fomites through other utensils, chair, table, handkerchief, and even towels. Diagnosis is mainly clinical, taking history, seeing the appearance of rash, type of rash, and laboratory assistance may be necessary to detect the IgM antibody and RNA of measles virus by RT-PCR technique of throat swab, serum, and urine. Treatment. There is no specific antiviral treatment for measles. Treatments are mainly symptomatic. If diarrhea occurs, treatment should be given like that. And if vomiting, there is antiemetics, antibiotic for severe infection, severe secondary infection mainly. Vitamin A supplement is necessary to decrease the severity and duration of illness. There should be healthy diet, which mainly contain vitamin A containing diet, which is very helpful, and enough fluid and hydration to be maintained by taking water and ORS. Prevention. Another is isolation of cases. The affected child should be kept separated from others so that they do not get measles. And vaccination, or pre-exposure vaccination, as per Indian Academy of Pediatrics guideline, 3 vaccines to be given. One is at 9 months of age, the second one is 15 months age, and third one is 4 to 6 years of age. And 1 dose of vaccine give 93%, and 2 dose of vaccine give 97% protection against measles. Post-exposure prophylaxis. Administer MMR vaccine within 72 hours of exposure if you could know it, or give anti-measles immunoglobulin within 6 days of exposure, but not 2 to a person. Any on either this or this, either vaccine or immunoglobulin. Measles is a dreaded but very common disease, and keep your baby protected by giving measles vaccine in proper time. Thank you for watching this video. Be healthy, keep your baby healthy, give him all type of vaccination in proper time. Thank you from Swapan Lifeline. If you do not still subscribe my channel, please subscribe for this type of video. Thank you.